Hi, everyone. Welcome back to Alcove Health Women's Clinic. Today, I'm here in the clinic with our nurse manager, Kinta, and today we're talking about incomplete abortions. So, Kinta, what is an incomplete abortion?
What we typically see for an incomplete abortion is women who have gone to have an elective procedure, an elective abortion, particularly the medical, the pills, and that incomplete means that not all of the pregnancy has been expelled from the uterus as it should have been.
Okay, and so this is what you would call a risk of having an abortion procedure.
Correct. So after an abortion, the pills, particularly, again, you're doing that at home, so it can be a little confusing how much bleeding there should be after the procedure. So initially, the first 24 hours, it's going to be pretty heavy. You can see some clots, some tissue loss, but then it should slow down over the next day or two, more maybe like a heavy to medium period. But then if a woman is suddenly bleeding like 2 pads in an hour for 2 hours, either the day after even, or the bleeding has gone down some, but then all of a sudden it's picked back up again, that is not normal, and that is considered too much and should be evaluated.
All right, and so as always on a camera clinic and a question, we have a question, and the question was just what you mentioned. It's noting the point that it's confusing to know what is okay and what is signaling something isn't right. The question is, how do I know if my symptoms after an abortion are normal or something is wrong?
So again, it's keeping an eye on your body, paying attention to the flow of blood that's occurred, paying attention to if you're having pain in the lower abdomen, if you suddenly start running a fever. Those can all be signs of infection, which can be caused from the incomplete abortion, because not all of the pregnancy is out. The body just is reacting to that.
And so medical care is definitely required for that.
Right. We typically recommend a follow-up within 1 to 2 weeks after the procedure to assess for the completion of the abortion, as well as make sure no complications have occurred.
And I know we've seen women here have come in who think they have their next pregnancy after an abortion, only to find they have not passed the pregnancy they thought they passed with the previous abortion.
They more than likely did not go for the follow-up exam that's recommended. And you really should, at least 2 weeks after the procedure, take a home pregnancy test and see if it's negative. And then if after 4 weeks or so, you're still getting positive tests, then it is possible that you've had an incomplete abortion. If you're not having any of those symptoms and you're thinking, well, I should be fine, but yet you're still getting a positive pregnancy test, you should definitely be seen by your doctor.
If you're in the local area and you're facing an unplanned pregnancy, we want to encourage you to come see us. If you're thinking about having an abortion, we want you to have a chance to speak with our nurse to understand all the risk, to also receive services like a lab-grade pregnancy test and an ultrasound to make sure you understand what's going on inside your body so you can make the best decision for your reproductive health. All of our services are free and confidential. So you have nothing to lose, right?
That's right.
Yeah, we're here for you. We look forward to serving you. Thanks, everyone. Have a great day.